TASC was founded based on an initiative at the federal level, providing funding to bridge the court system with the community-based treatment system.
In 1972, the Nixon administration, through the Office of National Drug Control Policy, developed treatment alternatives to street crimes, and it was primarily influenced by Vietnam veterans returning to the United States with addiction issues, heroin, alcohol, after seeing the pain and tragedy and traumas of war. My dad returned from Vietnam as an alcoholic.
Untreated substance abuse is pervasive in the criminal justice system. It entangles individuals completely and utterly.
My lifestyle and the work of TASC just kind of met some of the early names, Melody Heaps and George Williams, and people who were out thinking up things and ideas and approaches and bringing others into the fold, into what we ultimately started to call evidence-based programming. You could see the changes are taking place.
This is what pain and despair looks like. This was me a little over 10 years ago when I was at my worst. When I first got sober and I stood in front of a judge and my life was in shambles, and sure, I knew that I needed to address my underlying addiction, my substance use disorder, and it was causing all these problems. But it wasn't the only thing that I was worried about when I was standing in front of that judge. I was thinking about my daughter, who had been taken into DCFS custody and was in foster care. I was thinking about, was I ever going to see my mother again? Was my family ever going to accept me? Would I ever find a job? Had I gone too far down? TASC stepped in and helped me to organize all those things, those thoughts, all those challenges that I knew existed. So I was able to address one by one and take it in bite-sized pieces.
And it's very important that the specialized case management piece is just engaging with the clients. How I just met a client where they was at. They come in, hey, would you like a cup of coffee? Have a conversation with them. And one of the biggest things that I found out that will win trust with a client, just listening. Just a lot of times they just want to talk.
One of the things I am so proud of at TASC is the fact that our clients are at the center of the work that we do. Their dignity, their humanity, their goals matter.
Well, my path forward today is a new journey, a new chapter in my life, and to stay positive and focused on my treatment. I gotta take them one day at a time, little bitty baby steps.
So there are so many people who are involved in the criminal legal system, not because of quote unquote criminal issues, but because of health issues. And so if overnight we were able to get this population access to health insurance and therefore access to health care, it could be this game changer. And so TASC really led the way when Illinois expanded Medicaid in working in Cook County Jail to enroll people who are coming into Cook County Jail in Medicaid.
So TASC, through the Center for Health and Justice, which is the national and international arm of TASC that does technical assistance, that does implementation, it really serves in a thought leadership role, so well beyond service provision, but built on the ideas that come from service provision. And those ideas are generally around systems and how do systems work together. What TASC really does in Illinois and and through the Center for Health and Justice nationally and internationally is offer the way by which we call that a bridge, the way that that bridge can be built and put together. In other words, the professionals already knew that they needed to work together, they just didn't know how to make it happen.
It just doesn't seem real. It doesn't seem real that somebody who went as far down as I did was given an opportunity to have a seat, like at the executive table, to have a CEO and a group of amazing coworkers that value that pain that I went through, and that believe that it has a place here in helping others. I get to do this work that impacts so many other people, and if I can just create just one pathway for a person the way TASC created one for me, then all that pain and all that stuff was worth it.
TASC has endured a few name changes over its evolution, from treatment alternatives to street crimes, to treatment alternatives to special communities, to treatment alternatives for safe communities. Our new mission is to empower people and strengthen communities with impactful services. And so with that, we thought treatment alternatives for stronger communities was a better description for who we are and where we're headed in the next 50 years.
People go through challenges and, like I said, have many different paths. But by describing ourselves and the work we do as creating stronger communities, we take away that stigma that exists when we refer to things like safer. But when you add all that together and you think of the work that TASC does, what it really does is create stronger communities, and it strengthens an individual's opportunity at growth and change.
Building a stronger community means that individuals are being built up. They're allowed, and they're encouraged, and they're helped. What are the sayings? That it takes a village to raise a child? That's essentially what a stronger community is. It creates that village where individuals who may have gone through problems can help others.
We don't fix people. We empower people. Our goal is ultimately that people become contributing members of society and are able to give back to their own communities the way they receive support from TASC.
TASC has shown that love to the generations of people that they've helped and the people that they've helped by helping those people. TASC saves lives.
Happy 50th year anniversary. But thanks to all of the donors who've helped make it possible.